Hi guys, this is Alex from Salmonella Place. Today's pharmacology lecture is on central and peripheral muscle relaxants. So first, the central muscle relaxants. These are drugs that enter the central nervous system and cause a partial blockade. So the patient's breathing muscles are still functioning. There are three subgroups I'm going to mention when talking about central relaxants. These are the drugs that combat spasticity, acute muscle spasms, and drugs that work on both subgroups, so spastic and acute spasms. So first, spasticity, we use antispasmodic drugs, and the main one is baclofen. So spasticity or spastic paralysis is a clinical state which results from damage to the descending motor pathways of the spinal cord or the brainstem. This is in a result to trauma, stroke, or neurodegeneration. And what happens is there is an increase in spastic tone because the body tries to inhibit these destroyed pathways. So what the drug does to combat that is inhibit the increased muscle tone and reduce the spastic paralysis. However, a side effect of this is muscle weakness. Now, baclofen is a GABA beta receptor antagonist, so it inhibits the synaptic release of glutamine in the spinal cord. Now, let's go on to acute muscle spasms. So the drugs are mefenazine and cyclobenzaprine, and they're used after trauma and inflammation or a spasmodic disc herniation. However, the mode of action is unknown. We just know it helps with these acute muscle spasms. The last subgroup, which is helping with both spastic and acute spasms, we can use a GABA presynaptic inhibitor, which is Diazepam, or an alpha-2 receptor agonist, which is tizanidine. Now on to the peripherally acting muscle relaxants. The first one is very well known. It's oxytocin, which is a smooth muscle relaxant. It's a hypothalamic hormone in the breast and uterine. That's where it acts. It induces labor and increases the spontaneous contractions, and it's administered intramuscularly or intravenously. It can also be sniffed into the nose to induce milk production. Its half-life is only a couple of minutes because oxytocinase breaks it down in the uterus. Atosiban inhibits the labor, and ergometrine increases uterine contractions. However, it causes emesis, regional visual spasms, visual problems, headache, and increased blood pressure. It also causes tonic uterine contractions only after the birth, and this helps inhibit postpartum bleeding. Progesterone helps maintain the pregnancy, and if it's given with corticosteroids, it helps prolong the pregnancy through beta-2 stimulation for 2 to 3 days. Also, the corticosteroids help with surfactant synthesis, and they stop IRDS, which is infant respiratory distress syndrome. And lastly, papaverine, which treats abdominal pain and intestinal spasms. So that's all for muscle relaxants. If you have any questions or comments, please leave them below this video or send me an email at info@salmonellaplace.com. If you want to see more of my pharmacology lectures or other lectures on medical subjects, please go to salmonellaplace.com or one of the links below.